Another factor within your control before and after surgery is to completely avoid tobacco and nicotine. Tobacco and nicotine products cause harm in a couple of ways. One, nicotine, whether it's smoked or used in an oral pouch, causes vasoconstriction, or the narrowing of your blood vessels, for at least 2 weeks. If your blood vessels are narrow and constricted, they cannot effectively deliver oxygen and nutrients to the wound needed for healing. Nicotine also restricts these vessels' ability to create new vessels, or angiogenesis, which is crucial for wound healing. The other way in which nicotine and tobacco products harm you is because nicotine is not the only chemical that you're receiving. The specifics vary based on if you're smoking, vaping, but the other chemicals that are delivered via vapes and cigarettes are hard on your body and slow down wound healing. You might have heard that movement is medicine, and our current evidence supports this. Walking early after surgery can prevent a number of complications, including DVTs, or deep vein thromboses. That's why, earlier than ever, surgeons are having you up and moving as soon as you can after surgery. And this shouldn't stop after discharge. We want you to continue walking and doing whatever kinds of exercise that you enjoy and that have been cleared by your surgeon. As for the wound itself, you will likely have a small, well-approximated incision after your surgery, meaning the tissues are lined up and sutured closed. So you'll just have a small, thin wound that will likely heal over without issues. But you can still maintain the best wound bed possible by using principles of moist wound healing. We used to think that wounds healed best by letting them scab, but we now know that dry cells are dead cells, and wounds that are not too wet and not too dry heal the best, the prettiest, and the strongest. There are also plenty of drugs that you may be prescribed that can limit your wound healing. You should never titrate your own dose or remove any of these medications that have been prescribed to you without first talking to your prescribing provider. However, for general information, these are the drugs that can impact wound healing: high dose or long-term use of corticosteroids, some antimicrobials such as full-strength Dakin solution or povidone iodine, anti-gout drugs, anti-rheumatic drugs such as methotrexate, anti-neoplastic drugs, and anticoagulants. Again, please talk to your prescriber if you have concerns. Finally, as you prepare for your ostomy takedown, consider what you're going to do with any leftover supplies. There are plenty of organizations that help connect people in need to ostomy supplies, including Friends of Ostomates Worldwide, based out of Kentucky. You can contact your local ostomy nurse, as depending on facility policy, they may be able to distribute those supplies or use them for education. Good luck and stay hydrated. You got this.